Hi there. I'm Dr. Camilla Cameron, and I'm a doctor of traditional Chinese medicine for the last 23 years, and I'm also a vagus nerve stimulation expert. Today, I'd like to bring you a video about the anatomy of the vagus nerve and what dysfunctions of the vagus nerve may present as within your body. Let's talk about the anatomy of the vagus nerve. So, this is our 10th cranial nerve, and it's literally the longest nerve of the body. And our vagus nerve also innervates. And when I use the word innervate, what that actually means is the nerve is either stimulating, providing nerve fibers to an area, or providing some kind of energetic impulse to that area. So it literally innervates more organs than any other nerve in the body. And the reason the vagus nerve is called vagus nerve is because of its wandering nature. And vagus literally means wandering in Latin. The vagus nerve begins its journey within the medulla oblongata. The medulla oblongata can be found at the very base of the brain, where the brainstem and the spinal cord connect. The vagus nerve then splits in two to exit the two jugular foramen around this area, and then it comes across. It innervates parts of the ear, some of the face, then down through the throat and neck. When it passes through here, it creates innervations that are very important for swallowing and speech. The other really important thing it does in this area is innervates the thyroid gland itself. Once the vagus nerve has traveled through the neck, it then enters the thoracic cavity. Within the thoracic cavity, its job is to innervate the heart, and one of its really important jobs here is to regulate your heart rate. It also innervates the lung within the thoracic cavity, and this does two main jobs. One is to send signals back from the lung to the brain, and also it helps to stimulate respiration and control your respiratory rate or the rate at which you're breathing. From the lungs, the vagus nerve then innervates the diaphragm, and this further helps to control your respiratory rate. From here, it then enters your abdominal cavity to further stimulate or innervate the majority of your abdominal organs. So, this is where it really plays a massive role. The vagus nerve stimulates the stomach, large intestine, small intestine, uterus, kidneys, gallbladder, pancreas, spleen, and liver. So you can see it's playing a massive role within that abdominal cavity. When we talk about the gut-brain connection, which is a really common thing that we talk a lot about now, we're actually talking about the vagus nerve. So the vagus nerve is the gut-brain connection. It is the highway that the gut converses with the brain and vice versa. And that is such an important highway within our body. We are discovering more and more. So by stimulating your vagus nerve, you actually change your microbiome, you change your serotonin levels, which are then further transported via the vagus nerve to the brain. There are so many things the vagus nerve is doing with this abdominal cavity that hugely affect our health. Now that we have a broad understanding of the vagus nerve and its anatomy, we can appreciate that any kind of dysfunction, or we can also call it lack of tone of the nerve or damage to the nerve, can affect the body in all different types of ways and essentially cause varying symptoms, various signs that the vagus nerve is dysfunctional. And in one person, a dysfunctional vagus nerve can look very, very different to another person's dysfunction. And that essentially relates to which part of the nerve has lost tone and where that is anatomically within the body. So, if we look at the way the vagus nerve dysfunction presents itself differently in people and the different signs and symptoms we may experience, it's probably easiest to look at it from the top down. So, from where the nerve originates in the medulla oblongata to its termination somewhere around the cervix anal region. So, if we start from the top at this base of the brain where the spinal cord meets, you'll often find people have headaches in that region. Also, people who experience chronic migraines, that can be a vagus nerve dysfunction sign. And if we look further along where the nerve travels to, you'll often find there are some sort of ear symptoms. So you may have tinnitus, you may have a sensation of a blocked ear that isn't actually physically blocked. There may be some hearing disturbances. Also, when we move further along, one sign or symptom, as it can be perceived both ways, that people I find often experience is a hoarse voice. Now, this hoarse voice may be constant, or it may be, I find more people saying, I get this hoarse voice when I'm really tired or I'm really stressed or if I over exercise or when I wake up in the morning, I've had a really bad night's sleep, I have a hoarse voice. They may come into clinic with a hoarse voice, and I may notice as I treat them that hoarse voice really reduces. Also, difficulty swallowing. Another sign that the vagus nerve is impeded is actually a lack of gag reflex, or in some people, too much of a gag reflex. So, just a really over responsive gag reflex can be a sign of a vagus nerve dysfunction. Also, we have obviously thyroid issues can be relating to the vagus nerve as well, because it travels straight through the thyroid. So various thyroid diseases such as Hashimoto's, Graves' disease, or an underactive thyroid or overactive may relate directly to a vagus nerve dysfunction. So, still talking about the brain and head, I'd like to talk about mental health conditions, and in particular, depression, anxiety, bipolar, and potentially schizophrenia. I think we have accepted are not just mental health conditions, that there is definitely a physical component to these conditions. And I would propose that this component is the break in the gut brain connection, and this break is vagus nerve dysfunction. Another area of mental health I'd like to discuss is a lack of stress resilience. So, when I say that, what I mean is people who are constantly stressed. Everything is stressful. There is almost no way to regulate themselves down into a parasympathetic response. So basically, they've got no stress resilience. And I'm finding this is more and more common in the world we're living in, and especially since COVID and lockdowns and things like that. I think people are living in this real heightened stress response, which then I would term low stress resilience. And I do think this stress resilience or lack of it relates a lot to vagus nerve dysfunction, and in particular, that breakdown between the communication highway of the gut and the brain. Then we have PTSD, which we can either call a psychological condition or potentially a neuropsychiatric condition. And I believe the trauma associated with the creation of PTSD damages the vagus nerve. So I believe that some component of PTSD definitely relates to a damaged vagus nerve, and possibly, again, a damage in the communication between the gut and the brain. And then we have neurological conditions which may relate to a vagus nerve dysfunction. And these are things like Parkinson's disease, multiple sclerosis, epilepsy, and functional neurological disorders. Moving along to how vagus nerve dysfunction may affect the heart's performance. Some of the things you find is people who are experiencing palpitations and experiencing them regularly, and this is a new thing for them. Uh, this I would describe as potentially a vagus nerve dysfunction sign. Another sign could be that your heart rate has become quite low, much lower than it used to be, and sits at a much lower level. Unless you've gotten really fit, could potentially be a sign of vagus nerve impediment. And this, I would say, anything below 45 beats per minute that sits there regularly could potentially be a sign of this, as well as a heart rate that is excessive. So again, if you were once fit and became much less unfit, potentially having a high heart rate is to be expected. If this is not the case and your heart rate sits at around 100 beats per minute on a regular basis, this may be a sign that the vagus nerve is experiencing dysfunction. Vagus nerve dysfunction may present itself at the lungs as well. And things we can expect in this area are things like a persistent cough that's new and can't be explained by a virus or a bacterial infection. Sometimes people experience shortness of breath as a new symptom as well, asthma like symptoms, wheezing, that sort of thing, and also excessive production of mucus. So, all of a sudden, you're producing mucus for no particular reason. This could be a sign of a vagus nerve dysfunction. Vagus nerve dysfunction often presents itself at the stomach level. I do find most people who come to me for vagus nerve dysfunction or vagus nerve stimulation are coming to me with some stomach symptoms. So, one that I've seen a few times in clinic is gastroparesis. And this is essentially when the stomach loses its ability to empty itself into the small intestine. So it may lose its ability to empty itself completely, and this will often lead to vomiting after food, for example, or it may lose its ability to empty itself moderately. And this means that the transit time from the stomach to the small intestine is just way too long. And this often leads to a sense of feeling extremely full, feeling like the food is kind of sitting in your esophagus instead of your stomach. It's a very uncomfortable condition, but I have found it can resolve quite well with vagus nerve stimulation. The other conditions you might find that relate to a vagus nerve dysfunction are things like indigestion, heartburn. We've also got a sensation of feeling full all the time and having no appetite. And also, another one, conversely, is feeling hungry all the time, despite the fact you may have just eaten. The vagus nerve has a huge impact on the small and large bowels. And because a lot of their symptoms overlap with each other, I thought I'd put them together and make it a bit easier for us. So, the first one I want to talk about is SIBO. So, this is small intestinal bacterial overgrowth. And I find this does often relate to a vagus nerve dysfunction, and that using vagus nerve stimulation is often really useful in resolving SIBO. Then we have symptoms like chronic diarrhea and chronic constipation. And quite often we'll have people that alternate between the two of those as well. And usually that will be termed IBS. Now, people automatically seem to think, well, this is your colon causing the problem, the large intestine. And I can understand that thought process. But I do find in clinic that quite often the problem starts at the stomach level and then works itself through the gastrointestinal tract. So it doesn't always affect the organ that looks like it's affecting first. It may actually affect an organ above it, and then that causes problems in the organs below. And then we have the serious conditions of the large intestine, which are autoimmune related. So things like Crohn's disease, ulcerative colitis, and also celiac disease. And I believe all of these have a component of vagus nerve dysfunction relating to them. Then we have other large intestine related conditions such as diverticulitis and leaky gut, both of which I find are quite useful to use vagus nerve stimulation to gain reduction in symptoms or hopefully a resolution. Then there are several general digestive symptoms, which I believe most of these have a component of vagus nerve dysfunction associated with them. So we're talking about things like food intolerances. So newly developed food intolerances, think this is often a progression of vagus nerve dysfunction. And then we have worsening food intolerances. So people who just keep getting another food intolerance on top of another one. This is often, I think, a sign of mast cell activation and is definitely, I think, linked to a vagus nerve dysfunction. Then we have regular belching and burping, regular bloating, particularly kind of unexplained bloating, where you're just bloating after every meal or even just a drink of water. I would definitely be looking at that being some sort of vagus nerve dysfunction. And then flatulence. Three organs that I would like to put together because their functions are very related and they actually work in harmony with each other very well. And often, therefore, the symptoms of vagus nerve dysfunction spreads across those three organs. It's hard to distinguish which organ is being affected more than the other. So I'm talking about the spleen, liver, and pancreas and their very strong relationship with each other. So, when the vagus nerve is affecting one or all three of these organs, you can find various symptoms relating to this. So, for example, insulin resistance, prediabetes, or an impaired glucose tolerance test. That's a new thing. This can sometimes be related to vagus nerve dysfunction. Also, slowed detoxification. So, if you are, for example, finding your skin is breaking out and you're getting things like hives, rashes, or acne, when you weren't before and you're not eating differently or drinking differently, this may be a sign the vagus nerve is impeded and therefore causing the liver to express the toxins through the skin as it's no longer capable of moving the toxins through the body. Also, pathology, as in blood markers, high inflammatory markers within the blood, is often a sign of vagus nerve impairment. And the other thing that we find, which does relate to the pre-diabetes side of things and the insulin resistance, is unexplained weight gain. This can also relate to a vagus nerve that is dysfunctional. One of the vagus nerve's really important functions is its regulation of systemic inflammation, so its ability to dampen down the body's inflammation. So when the vagus nerve is impeded, it will actually reduce this function and will actually allow systemic and chronic inflammation to flare up and cause heaps of problems within our body. So essentially, in my opinion, pretty much all disorders of the body involve chronic inflammation. So almost any condition we can talk about, we can say the vagus nerve has possibly got a part in establishing or continuing that disorder. So just for some examples of conditions that are known to be treated quite well through vagus nerve stimulation are things like rheumatoid arthritis, chronic pain, fibromyalgia, migraines, chronic headaches, POTS, and also mast cell activation. Because the vagus nerve fibers also influence our ovaries and uterus, we can probably assume that the majority of gynecological conditions have some aspect of vagus nerve dysfunction associated with them. For example, a recent study found that women with endometriosis had lower vagal input than those without endometriosis. And another very recent, this year in fact, study has found that women with PCOS or polycystic ovarian syndrome also have lower vagal activity than those without it. We can also assume that delayed fertility may be impacted by vagus nerve dysfunction, as well as painful periods. Thank you so much for watching my video on the anatomy of the vagus nerve, the organs that may be affected by dysfunction of the vagus nerve, and what conditions may be associated with vagus nerve dysfunction. Please have a quick look at my disclaimer, which overall is basically saying I'm a doctor of traditional Chinese medicine, but I may not be your doctor of traditional Chinese medicine, and everything I post on YouTube is designed as an educational tool. It is not to be replaced for a proper diagnosis by a health practitioner. If you'd like to get in contact with me and have an online consult, or if you're lucky enough to live in Brisbane, have a physical consult with me, feel free to have a look at my booking link below.